health product regulator, SAHPRA, has approved a Section 21 emergency use application for the Pfizer-BioNTech COVID-19 vaccine. In addition, South Africa has conditionally secured about 20 million doses of the J&J vaccine that are expected in the country at the end of next month. That's the end of April. But according to the MediaHack vaccine calculator, South Africa's current vaccine rollout is also below par, and if efforts are not stepped up, it could take about 11 to 18 years to vaccinate the population. Our next guest, probably best known for her reproductive health and HIV work, wears so many medical hats that Professor Helen Rees, for this interview, can we just simply refer to you as the chair of the Health Products Regulatory Authority just for this morning?
With pleasure.
Good to have you. Thanks for being with us this morning. So, healthcare workers, vaccination, I think we're sitting at about 147,000. Those are the approximate numbers. People are beginning to worry a little bit, and why are we falling behind, even with healthcare workers, in terms of vaccines?
Well, the initial rollout that we're doing at the moment with the J&J vaccine for healthcare workers is what's called a phase 3B trial. It's open label, there's no placebo, no control group, so everyone's getting the vaccine. But it does mean that it is being done in the context of a clinical trial where we're collecting more data and we have more procedures required than will be required for a rollout. So that is one of the things that's slowing us up. And it's also being rolled out from special centers where we have research teams as well as Department of Health staff working together. So it's a much more complicated process than what we would anticipate for the national rollout that is yet to come. The second thing is, of course, that as we're doing this, we're learning. And, you'll have read in the media, as I've done, it hasn't always gone perfectly, long queues, complaints, etc. So we need to learn on the way. Mm-hmm. But I think everyone would agree that we're trying to accelerate that 3B rollout. And certainly when we come to a national rollout, we will have to go much more rapidly than this. Yeah. And the preparation is ongoing for that.
Because it is worrying, because the reality is that we're watching a lot of other countries, and I'm not going to compare ourselves to the likes of the US and to the UK and other more developed nations. I'm going to talk on the continent itself. I just saw a report coming out about Rwanda and how fast Rwanda are actually doing their vaccinations. And they just a report saying that they have vaccinated 140,000 people in just 2 days. We've been on at this for 3 weeks, but this isn't even our national vaccine rollout, and I understand that. So you've given us a good enough answer to understand why it's not going as fast as it would as a national rollout. When is the national rollout for vaccines actually going to start in South Africa? That's the big question.
Well, I think everyone who's involved agrees, the sooner the better. But there are negotiations, first of all, to purchase the vaccines. As you know, we had a start and then a stop with the AstraZeneca, which really did put us back. We're hoping to get some Pfizer vaccines in by the end of this month, and then we'll be getting more Pfizer. There's a negotiation for a large quantity of Pfizer, many millions, but by the end of this month, we're hoping to have 600,000. And also, as you said, the J&J vaccine. So I think that the aim would be, as soon as we get these vaccines in, the Department of Health and all the provinces are really geared up to start to roll this out. And as soon as we can get them into the airport and ship them out, we should start this rollout. I agree with you, that as I said before, we want to go as fast as we can. But to be fair as well, even countries like Rwanda didn't go fast to begin with. They had to get everything into gear. And once you've done that, then the rollout becomes much more straightforward. But I think people have already seen that, we have the online vaccine registration. That's happening, that's been tested, it's been adjusted through this period with the J&J 3B vaccine trial. That's been modified and improved all the time. So I think, hopefully, in April we would be targeting to start rolling out these vaccines that we're hoping to receive at the end of this month.
So that would be, just to recap, that's the 600,000 Pfizer vaccines that we are hoping to receive, and that is also the subject of the interview, because we've seen that Section 21 emergency use of the Pfizer vaccine has now gone through. So this Pfizer vaccine, does it work, and is there a high efficacy against the strain in South Africa, the one that obviously threw a spanner in the works with AstraZeneca?
Yes, and it's an incredibly important question, and it's just to reassure everyone, it's not just South Africa who's now trying to answer this question. All the vaccine manufacturers are at the table trying to answer this question, but also globally. There's a huge amount of work. I think many of us are spending many hours every day with global consultations with the World Health Organization, really looking at what needs to be done to ensure that the vaccines we currently have work against the number of variants that exist in the world. We're not the only country that has a variant. So for Pfizer, this is what we know. It's a highly effective vaccine. It's a 2-dose vaccine, highly effective, 95% effective against serious disease, severe disease. But we also know that in the laboratory, it's also affected by the variant. So this variant is more resistant to the antibodies that are produced by the vaccine than the original variant that we had at the beginning of last year. This virus and the changes that it's gone through have made it much more difficult for us to challenge. But our feeling is, because it's such an effective vaccine, that we're pretty confident that it's going to work, if not as well as against the original virus that we had, that it is going to work. Now, having said that, however, we are working with Pfizer and with the other vaccine manufacturers, and they are producing from the laboratory data that shows how effective it's likely to be against the variant. We know that it's somewhat diminished for Pfizer, but it's not, the effect of the vaccine is not wiped out completely in the laboratory. So we're very optimistic that it's going to work, and particularly work against severe disease. We will have in place a mechanism to monitor continuously for all the vaccines we introduce, hospital admissions, whether people have been vaccinated or not, and confirming whether they tested positive for an infection. So we'll be able to put all of that data, those 3 pieces of data together, and we'll be able to see if there are breakthrough infections either with the Pfizer or with the J&J vaccine.
Okay, so if we have to do the comparison between the Pfizer vaccine and the Johnson & Johnson, obviously at the moment Johnson & Johnson is the preferred vaccine because of the storage, the efficacy, all of these kind of things. Pfizer, however, if I'm not mistaken, this is the vaccine that has that storage of minus 70 degrees, but apparently if it's undiluted, that is not an issue. Perhaps you want to talk to us about that, and is that a problem for South Africa and a rollout here?
Well, it is a challenge for any country, whether you're rich or poor. I mean, having these ultra-cold storage requirements is a challenge. But that has been looked at by the Department of Health. There's central storage and provincial storage facilities that will allow that to be taken out. And then there are procedures being put in place that allow it to be taken from those central storage facilities to the facilities where we're going to be administering the vaccines. The other thing is, of course, the company themselves are continuing to look at the storage conditions, and they're learning more about the stability of this vaccine. And I think we're getting more confident about how we can use it in our setting. But that has been thought about, and that preparation is well underway.
All right. I want to talk to, all right, so we've spoken about when we possibly can be getting some vaccines, the Pfizer 600,000. At the end of next month, we're expecting that large delivery of Johnson & Johnson, but that's the end of April. And a lot of projections are talking to the third wave, where, South Africa in the next couple of weeks could start seeing these numbers increase quite a bit, especially as we get colder. The vaccine is not right now a solution for us because as we're seeing, it's a slow rollout. What are the projections? What are the predictions with regard to a third wave and a reality with regard to this?
Well, I think one thing that I think we've all got to take responsibility for is what happens over Easter. Because if we go down a traditional Easter route with many mass gatherings of different sorts, some for social and pleasure and some for religious reasons. If we have large mass gatherings over Easter without social distancing, without mask wearing, then we are going to set the scenes ourselves as citizens for a third wave. If we stick to the rules and we avoid those mass gatherings and we continue to do the distancing and the public mask wearing, which is incredibly important, then we can perhaps avoid a third wave coming soon after the Easter period. But I think many people think that we will be seeing a third wave in perhaps May or June. The size of that third wave, I don't think any of us can predict. That second wave was huge. In some settings, we're seeing as many as perhaps 70% of people having antibodies after that second wave. So we don't know what the size of this third wave is going to be. But of course, we're all hoping that we're not going to see something as dramatic as we saw in that second wave. But most people are in agreement that we are going to see a third wave.
Yeah, certainly. I mean, it is a reality. It hasn't gone anywhere. And we've seen what has happened in Europe at the same time, even though they were vaccinating at the time, and yet there were still these waves. Talking about Europe, several European countries have halted the use of AstraZeneca as well, because it's believed to have caused blood clots. As we know, in South Africa, we have some doses. Where are they? Have they been sold off to the African Union, as said? And I mean, what are your views on the whole blood clot issue?
Well, the Department of Health are the people who are negotiating on the sale, but I think that that's quite far advanced, and I think they will be transferred fairly soon to other countries. In terms of the blood clots, one thing just to remember is when we do these trials, even though we do huge trials, Pfizer, for example, is 40,000 people, J&J, similar numbers of people. These are huge clinical trials that give us data, and all the time we monitor safety. It's very different then when you start to roll it out to literally millions and millions of people. And that's why worldwide we have a network for reporting on the safety of vaccines, and any safety signal that we see will be reported from around the world. So what's happened in Europe is that they saw several cases of blood clots, and that's really made people alert to the fact that is this a side effect? But that is being investigated at the moment, because if you take tens of millions of people, by the way, the majority of these blood clots appear to have occurred in women. But if you take tens of millions of people and you look at them, people will get blood clots in a period of time. Yeah. So what you have to do with these, when you get these sorts of reports, is do two things. One of the things you have to say is this actually a side effect of a vaccine that's been newly rolled out to millions of people? Is it increasing the risk of these blood clots? Or are we seeing what would have happened anyway in life, that this is something that would have happened? And that's called causality. Can we attribute that symptom or that disease to the vaccine, yes or no? That's the first thing. And if you find that you think there might be causality, you then have to say, is this extremely, extremely rare? And then does the benefit of the vaccine exceed any potential risk? Because the risk is so small, but the benefit of the vaccine is so huge. And that is the process that's ongoing, and that hasn't been finalized yet. So these suspensions are temporary while those discussions are taking place.
All right, Prof, we'll leave it there. Thank you for talking to us. Thanks for shedding some light on this issue. Professor Helen Rees talking to us about South Africa's much-needed COVID-19 vaccines, giving us an update as to when we're getting how the process will unfold. But, as it stands right now, obviously, it is very, very slow. But the national rollout is still yet to begin. This is just the healthcare workers for the Johnson & Johnson Sisonke program. So, yeah, anyway, there you go. Those were your details.